For the first time, California is looking at lifting the citizenship requirement for adult Medi-Cal benefits. KPIX 5's Melissa Caen looks at the debate over insurance for undocumented immigrants. Melissa?
Yeah, Alan, we got a hold of the budget blueprint for the California State Assembly. Now, this blueprint lays out the Assembly's priorities as they move through the budget process that starts in January. Now, in it, $1 billion is set to extend Medi-Cal coverage for nearly 2 million undocumented immigrants.
Many of these undocumented folks are the ones who clean the streets, who mow lawns, who, clean people's homes. They need insurance too, because guess what? When they get sick, they end up in the emergency room, so the taxpayers pay for it anyways.
Chairman of the Assembly Budget and Finance Committee, Phil Ting, says the Assembly has a goal of universal health care, and that means finding a way to cover the 6% of Californians who have no health insurance, a majority of whom are undocumented immigrants. Ting says providing Medi-Cal to that population will save money.
We think it's going to be cheaper and better for the public health outcomes to move this direction.
But it does not save taxpayers money. There's no evidence that's the case, because quite naturally, once you give a low-income person health insurance, then they tend to use a lot more health care. So you're not going to save any money.
Steve Camerata is the director of research at the Center for Immigration Studies. And he says this is not just reshuffling money, it's a decision to spend more money on one thing over another.
Or those who defend this policy have to acknowledge several things, the most important of which is there is not an unlimited amount of money in California to take care of legal immigrants and the native-born poor.
Assemblyman Ting says that discouraging undocumented immigrants would be bad for business.
If we wanted to reduce the number of undocumented people in California, it would have a huge effect on our agricultural industry, which is, a multi-billion-dollar industry, so that industry is not calling for that.
Camerata says that businesses prefer undocumented workers so they can exploit them, knowing that taxpayers will pay for benefits.
There may be businesses in California, whether they be construction or restaurants or farmers, who love this situation, but the taxpayer inevitably gets kicked in the teeth.
California already offers Medi-Cal for undocumented young people. Ting says that the conversation about expanding Medi-Cal to undocumented adults is just beginning.
We're not planning on doing it all next year, but this is what we're taking a look at.
Now, we wanted to know what people think about this. So our exclusive KPIX 5 Survey USA poll found 40% of Californians say that, yes, the state should give Medi-Cal to illegal immigrants, but 43% don't think this is a good idea. 17% aren't sure. But there's actually less support for this plan in the Bay Area. Only 31% of Bay Area adults support the plan, and 44% do not want illegal immigrants to get Medi-Cal. 25% of the Bay Area say they are not sure. Now, Assemblyman Ting says that in addition to expanding Medi-Cal, also on the table is the single-payer plan still at play. Melissa Caen, KPIX 5.